Hi everyone, welcome to our condition of the week. This week's topic is neck pain, a pretty serious one, and one that we have great results with again as chiropractors, because again it tends to be more of a structural problem. It's important to understand the anatomy of the spine of the neck. The neck tends to be a pretty narrow base, a pretty narrow pedestal, which your head rests on. The head's like about an 8 to 10 pound bowling ball resting on this very narrow base. So you can picture the types of things that can cause your spine to get misaligned, the traumas, the car accidents. You can picture in a car accident that neck getting snapped forward and back, leading to misalignment or subluxation in the neck region. The study done at Yale said that as little as an 8-mile-an-hour crash can cause brainstem damage in about 50% of the people. So real important to understand that, and also understand that further research has shown that the degeneration that we talked about last time when we talked about low back pain actually starts to occur within about the first 10 days. So everyone should be checked after a car accident, even if it's minor, by a chiropractor, a competent chiropractor, to make sure that they do not have misalignment or subluxations. Another type of problem that we see in the office is called torticollis. And many of you may have experienced that. That's where you wake up and you just aren't able to turn your neck in one direction, or you may have had a little baby who was unable to nurse. They were having trouble turning their neck, so they were more comfortable nursing on one side than the other. Probably the misalignment in that case would be brought on by the birth process. In adults, often the torticollis is a result of past injuries that they've had, the misalignments in the neck, and then that sleeping on the couch all night has really led to put you over the edge and led to the locking of those joints. In the spine, there are little joints called facet joints, and they guide the movement of all these bones. They're two smooth surfaces with fluid between them. So when you have your traumas, or if you sleep with your neck in a funny position, it can kind of move that joint into a position where it gets locked out of position, and you just cannot move the neck. In most of the cases that we see torticollis, it occurs in the upper part of your spine. And why it occurs there is that that's where most of the motion of your cervical spine occurs. About 50% of the rotation of your cervical spine occurs in these first two segments. Now this is, it's important to understand that in this area, this is where the spinal cord goes down through, right? The brain sits up here, the spinal cord goes through to innervate all the rest of the organs and muscles and cells and tissues of your body. The nerves from this upper cervical area do go to your head, so it can lead to things like headaches, dizziness, ringing in the ears, blurred vision, sinus problems, that kind of thing. But in this region where I'm showing you my fingers pass through, when these vertebrae get misaligned, you can see how that opening can get occluded. This is where your brainstem is, and the brainstem is really where the centers for controlling the major organ system in your body come from. So misalignments in this region of your spine can really have health effects all throughout your body. Now the third type of problem that we see in the office is the kind of the tension and tightness in the neck and shoulders that you'll see with a lot of people, and they get those neck aches and headaches along with them. And they can be caused by stress and tension. You can picture someone who gets under a lot of stress and they start to tense their muscles and alter their posture and get that altered alignment in their spine. But a bigger reason these days is really because of the technology that's out there. Now people are working on computers, and when we work on a computer all day long, we're sitting there for 8 hours a day typing and with our head down in this forward head posture. Or children or teenagers that are using their phones for texting all the time, they tend to be looking forward with the forward head posture way too long, and that's leading to a loss of that normal, natural curve in the spine. It should normally curve this way, and they're getting into actually a reverse curve in their neck. And when that happens, if you can picture, this is your normal curve, and then when I start to lose that alignment, you can see the tension on that elastic band increases. So can you picture the increased tension on the ligaments and muscles at the back of your neck when you start to lose that alignment? There's also increased stress on the discs, the little pads between the bones that kind of act like cushions to support the vertebrae in your spine. The research on this is that I'm going to do an analogy here with you. It's called the bowling ball analogy. I want you to try to picture holding a bowling ball out in front of you like this, and how long could you hold it? Probably not very long, right? but as you move the bowling ball back into your chest, you could probably hold it there for hours. Now, the research on this is that they say that for every inch that your spine moves forward of that natural ears over the shoulder kind of balanced posture, for every inch that it moves forward, it increases the stress on those muscles at the back of your neck as well as those discs by about 10 times. Now, these x-rays that we have up here are actually x-rays of two 55-year-old patients. And this first x-ray is actually my x-ray. You can see that nice normal curve there. The disc spaces are all well maintained. There's no spurring. I've been under regular chiropractic care now for the last 25 years. This gentleman actually came to see me. He was born on the same day, and you can see how he's got severe forward head posture, and his spine has gone into severe narrowing of the discs and spurring. Neglecting your spine for years leads to the cavities that we talked about when we talked about low back pain last time, right? The degeneration's occurring. And the concern here then is that this area of the spine is where the cardiopulmonary nerve comes from. So this is the nerve that controls your heart and your lungs. So who do you think is more likely to develop issues and problems with their heart and their lungs? Mine, my spine, or this gentleman here? The science out there actually says that this type of problem, the forward head posture and the degeneration, is probably leading to 15 to 20 years decreased life expectancy for these patients. So what we do as chiropractors then is gently adjust your spine or these vertebrae that are misaligned back into position, aimed at trying to get the stress off the nervous system, but also aimed at trying to get the proper motion back into those segments. We want them to start functioning properly so that they won't continue to degenerate like you're seeing in this x-ray behind me. We also use a cervical extension pillow aimed at trying to get that curve back into the neck for the patients. That will work at stretching these front muscles so they can actually bring the head back up over their shoulders. So the basis of what we're doing then is we're working at the correction of the mechanical problems, getting the spine moving better, lined up better, functioning better, and by doing that, we allow the brain to start communicating with their body so that it can start to neurologically function better as well and improve your health. So I hope you gained some good insights today. I want to thank you for watching, and we'll see you next time when we bring you our next topic of the week. Thank you.